area in particular that we're really just going to be focusing on is just in general right here. She's otherwise very attractive young woman who just has a little bit concern of some of this fullness that she finds and sees, in her selfies or in her photos. So what we're really going to try to do is focus on targeting this area in particular, which is what the FDA indicated and wants us to be able to use. One of the exciting things about Kybella is that it's really able to target the central portion of the neck and has a little bit of a diffusion zone. So whenever we end up marking this area that I'm going to be treating you with, we'll end up having some nice thinning of the fullness further out as we go out a little bit further. Now, in order to make sure that we get the injection the safe way, I'm going to mark a few different areas in particular with just my white little marking pencil. You just turn your head away from me for a little bit. Now, my patient in particular, once again, already has a pretty nicely defined jawline. But just to make sure I don't fall off a track, I'm going to go ahead and mark out this portion of her jaw. And if you go ahead and turn right over here, and we're marking this right along the axis of what we call her mandible. Turn your head towards me, please. So I'm staying right, and I can feel that the bone, the jawbone, the mandible is just below. So we're going to treat below this. Now, the other thing we want to make sure we do is avoid what we call the marginal mandibular nerve, which is a nerve that's responsible for moving the facial muscles in a downward direction. So in order to make sure we avoid that, we focus on about 1 finger breadth or about 1.5 centimeters below. So as we kind of start working this way, this is also going to be an area that we don't treat. And I just like to mark her submental crease and just follow that around. Tilt your head for me this way, please. And again, about 1 finger breadth below. And we connect the dots. Now, what I also do is mark out a portion of her muscle out through here, which is what we call the sternocleidomastoid, and I can see the edge of it right through here. So as it comes straight down, and tilt your head that way. And again, I can feel and see the edge of it right in here. Right there, actually. There we are. Now I want you to strain your neck, kind of like strain it, like there you go. When she does that, I can feel some of this fullness right in through here, which we're going to treat. And relax, tilt your head down, and I follow a portion of her mouth down through there, and the angle of her mouth, and bring it down in through here. Now what I feel for is her thyroid cartilage and the notch right above it, which I feel to be right about here. And as I go up a touch higher, her hyoid bone, which I find to be right about there. So now this area in particular is the area that we can safely treat as we go across this fullness in through here. So this is really going to be our target zone in particular for helping treat her and get rid of this fullness, and as it kind of thins out down and through her neck. Again, as I was mentioning, you're going to have a little bit of diffusion out through here, so it's going to have a nice contour effect. It's not like we're just going to thin this out and everything else will look the same, but we do not inject out here, and we definitely do not inject in this zone, but focus more in through this particular region. In particular, the FDA, by injecting anywhere outside of this zone, there's important structures out here that we really want to avoid injuring or even getting close to. There's a blood vessel called the external jugular vein. There's also what we call the great acoustic nerve, which is what provides sensation to all of this area. That spot's generally found 6.5 centimeters just below the level of her tragus. So we could find that just a part on our ear. So we would want to avoid anything really out and through this area. And by injecting higher in through this zone, we run the risk of injuring what we call that marginal mandibular nerve, and it would affect what she has as a beautiful smile already. It would make it asymmetric. So we really focus on where the most amount of extra fat's going to be, and that seems to be right in this vicinity.